I just want to thank Deb for her very kind introduction and tell you how glad I am to be here. I've been fortunate enough to attend, I think this is my third Soft Bones meeting where I could meet patients and families other than the ones that I treat at Shriners Hospital, and it's really important to me and helpful to my career in learning a little bit about the adult population too, because that's where my children that I'm treating are headed. But I can tell you since 2013, when we started being more involved at our hospital with our metabolic research unit, that I was able to participate in some of the post-clinical trial studies where we were watching children walk and looking at their gait and realizing that there's more just to them walking farther, but they're walking better. And so we became involved in looking at the quality of gait and working on some outcome tools to help support the FDA approval of Strensiq. So I feel very fortunate I was in the right place at the right time, and I've been able to learn a lot from all of you in the meantime. So thank you so much. So I'm here today to help you learn a little bit more about listening to your body, because I feel like it's not all just about hypophosphatasia. Physical therapy can help you in certain ways by helping you measure some of the functional things that you do, and also we're not just those people that are stretching and strengthening you after you've injured yourself. We actually have a role in being proactive and helping to measure things at baseline to see where you started and where you're headed. And if I can make this work, I'll be good. Okay, so the objectives today are to learn how physical therapy can help you listen and know your body better. Learn how to educate others on your condition and about you specifically, because as we've heard today and all of you know, there's such a wide range of symptoms and severity with this disease. So you're different than every other person that has HPP. Your orthopedic history, your clinical findings, your labs, your x-rays, they're all different. And we need to consider your goals of exercise and therapy. So each of you have a goal of something that you're trying to achieve. Maybe it's to be able to walk farther without being tired, or you don't want to fracture your foot again, or you're a child that wants to play and keep up with their peers. So, and I think it's important in my last objective is to involve your specialty physicians and your multidisciplinary team. So I feel very fortunate because the hospital I work at is one that really includes physical therapy as part of their multidisciplinary team. And so we help support some of the things that they're looking into, and even sometimes helping determine whether there are enough functional issues present to warrant pharmaceutical treatment or other treatments. So take time to listen to your body. And what are your symptoms telling you? And I think Deb was probably one of the first people who asked me, Donna, could you explain the difference between good hurt and bad hurt? That's a tough one, but I would define good hurt as maybe a mild discomfort when you've worked out and you can feel it in your muscles. You know, it's not painful, but you can feel that you've done something more than a normal workout. Bad pain, however, is going to be a sudden pain, maybe an inability to weight bear. You were walking and now all of a sudden something hurts. You know, you may have fractured. And you may have pain that is not relieved by changes in position or ice or activity. Those are bad pains, and that's something that you probably need to investigate a little further with your physician. Sitting or standing. So many of you may sit at a desk during the day and realize that sitting is one of the biggest problems that you have. It's painful for you to sit for a prolonged period of time. Or maybe standing is what's causing you pain because you may have flat feet. And so sometimes just paying attention and listening and thinking a little bit more about what position is causing you more pain can help the rest of us, your physicians, your therapists, help you figure out what the cause is. And then many have a daily level of discomfort. So children don't really, I can agree with one of the physicians earlier stating that the kids don't really complain that much because they're too busy playing. You know, they just want to move on to the next thing with their friends. But most of you probably have a daily level of discomfort that's normal for you. So a bad pain would be one that is beyond that normal level of your acceptable, if you want to call it that, acceptable level of pain. And certain activities may make pain worse. So paying attention to that is important. Posture of your feet, your knees, your hips, and your spine. So posture is hugely important. If you have very flat feet and you're standing all the time, that tends to make your knees come in a little bit closer together and cause you pain at your knees. And so having some good support underneath you is very important. And making sure that you're sitting with good erect posture so that you don't end up in the future with some of those postural issues that can happen with osteoporosis. And then do you have difficulty with balance or single limb activities? That's a lot of times a sign of weakness, and that's something that we can help you with. So this is my after lunch little activity because I don't want you all to fall asleep. Raise your hand if you feel more comfortable walking up and down stairs with a handrail or leading with the same foot each time. Okay. You may have some hip weakness. So there are tests and measures that therapists can do to look at your strength. You may have a Trendelenburg's, which is a standing sign. When we have you stand on one leg, if your hip drops, that tells us that the stance limb has some weakness proximally, and that may be why it's hard for you to walk up and down stairs. So even knowing that about yourself, you know something. You may have some hip weakness. Now raise your hand if you've experienced hip pain after sitting for a long time at your desk or a car ride. Yeah. You may have limited range of motion in your hips and not even know it. Or you may go to a therapy session and your therapist says, I'm going to stretch that hip and make it go further. Sometimes your hip doesn't go further, okay? There's a difference between a soft end feel, which is soft tissue stretching, and a hard end feel, which is kind of a bony block. And so if therapy is making it worse, that's important to tell your therapist too. And sometimes if they don't listen, or if someone doesn't listen, you might need to move on. If your feet hurt with increased activity, raise your hand. If you've noticed you have flat arches. So you may need to not wear those flip-flops that are really cute, but if you're going for a long walk, you might try some more supportive shoes, be fit for shoes, or maybe try an orthotic. Because there you go, I forgot that one. You may benefit from supportive shoes or shoe inserts to reduce the chance of metatarsal fractures. So that's, again, another reason why you could be proactive by supporting. And it's not always because you don't have an arch. It could be that you're weight bearing on the lateral side of your foot, too. So you want a balanced foot where your foot is in contact with the floor in as many places as possible. Now raise your hand if your favorite outdoor activity or exercise causes you pain. Okay, you may need to find an alternate aerobic activity that's low impact, okay? If you're a jogger and you've had a lot of metatarsal fractures, we may have to find another activity, but it can be just as fun and just as aerobic. All right, so you may already know some of these things. We probably talked about them today, but clinical findings in children with HPP, which can affect activity and participation, include delayed gross motor development. A lot of times that can be caused by hypermobility at the ankles, at the knees. It can be caused by endurance. It can be just in general gross motor delay. Children can have fatigue. It occurs when their muscles are weak or maybe their movement's less efficient. So the typical HPP gait that we are starting not to see anymore, but what we saw before there was a treatment, is a waddling type gait where kids take their body back and forth, and adults back and forth over their hip as they're walking. And that's a less efficient gait that can cause some fatigue. Bone pain, decreased endurance, and that can be decreased endurance for children. That's going to be compared to their peers. They just care about keeping up with the rest of the crowd, and so it presents in varying degrees depending on the severity of the disease, whether that's a problem. Muscle weakness, a lot of times those proximal hip abductors are the problem that are causing some weakness, and again, that's can be demonstrated by a positive Trendelenburg, which actually, when I found this picture up here, she actually has a little bit of a Trendelenburg. And you can tell that because when you try to stand on one leg, your other knee touches the other limb, and you can't really support yourself without having those body parts touch. Or there could be some gait impairments. And impaired gross motor function with running, transitions, and stairs. So in that instance, gross motor function are things like getting up and down from the floor. When you get up and down from the floor, can you stand up without holding on to the wall? Or, can you just pop right up, or do you need to hold on to something? All right. Now on to the adults, and I'm always interested in the adults side because I mainly have dealt with children, so only at the Soft Bones meeting do I get some more information and some of the parents about adult issues, but we know that adults have issues with joint limitation, so it's important to know those baseline measures of your range of motion if you're going to receive therapy. Bone pain and fragility, limited endurance, limitations with activities of daily living. And activities of daily living are all those things that you're doing every day. You know, a lot of individuals have difficulties with hand strength. And sometimes occupational therapy can be a helpful therapy or tool if you're having issues with that. They spend a lot of their profession helping people with ADL issues by giving different tools like grippers or reachers or things like that that can help make those things a little bit easier. And then it's always important to just keep track of BMI, your body mass index, because if you are not able to be as active as you want to be, it is hard. It is hard not to have weight gain. And so just paying attention to those things are helpful because it does affect you orthopedically and add to fatigue at times. So the tests and measures that a physical therapist has access to, I think, are sometimes why it's helpful to include us as part of your multidisciplinary team. We have clinical outcome measures that we can test at baseline, and that kind of gives you that start that you're looking for to know where you started from. As more and more individuals have been treated with pharmaceutical treatment, if you don't have that baseline, it's a little bit harder to tell how you improved. And sometimes your insurance companies are wanting that information, or it's part of a clinical note for a physical therapist, but it's also important for you to get insurance coverage sometimes, or for someone to understand where you've come from and where you're going. So range of motion is taken up in that top picture with the foot using a goniometer. So a lot of times we do take measures. Sometimes patients, children tend to have hypermobility at their ankles and sometimes at their knees. But adults, it seems, have some limitations at hips. So it can be too much range of motion or not enough. Strength testing is done either with a manual muscle test where a therapist will push down on different muscle groups to see how strong you are, or maybe more specific measures such as a handheld dynamometer, which is what's shown in that picture up there, to test grip strength or to test the strength and give pounds of force measures to the different muscles in your body. Super important is posture. I can say that one of the previous patients that Dr. Gottesman presented was also one of my patients, and it was really an incidental finding that he had a scoliosis. And I think we found it in one of the sessions that he was in for as part of his standard testing, but that led to him to having some further treatment for that, so it did not get worse. We do endurance testing, and I'll talk a little bit about some of those standardized tests. We look at gait quality, pain level, and maybe some aids to help relieve pain, and quality of life, which is super important. That's why you don't want to have pain. You want to have a better quality of life. So because range of motion can be limited, it's helpful to know your bony limitations, so knowing yours personally. Stretching is not always warranted if there's a bony block where there's a hard end feel. And joint protection is important. So if you have hypermobility, then we want to try to protect those joints. Sometimes that's putting something in a shoe, or maybe the physician referring you for an orthotic or something that's needed. And then there are standardized assessments. And a lot of these, I just participated in a tele-echo presentation in May about pediatric functional outcomes. So these are some of the outcome measures that have been commonly used with patients that have hypophosphatasia, and they're out there in the literature. And so this is just kind of a high-level look at these. For more detailed information, the tele-echo is available and has a little bit more specific information about some of these tests. But a lot of standardized tests for infants and children are based on their age. And so the Bayley Scales of Infant Motor Development is a scale from ages 0 to 3, and it looks at gross and fine motor, language, and cognitive development. And again, the most important part of these standardized tests are to have them so that you know where your child started and we can see progress. Or maybe it is to decide whether a child needs treatment, not at this age necessarily, but as they get older, trying to decide whether someone needs treatment. the Peabody Developmental Motor Scale, and the BOT, which is the Bruininks-Ostrowski test. And so again, that test goes up to ages 21. And these tests have been used in some of the clinical trials and are used regularly in some of the protocols if you have a multidisciplinary team that you're working with as a group. So measures of gait and endurance, the 6-minute walk test. I'll bet, has anybody had a 6-minute walk test? I'll bet you could raise your hand, and we've got a lot of people who have walked back and forth doing the 6-minute walk test. So that is a walk test that's performed in 6 minutes. There's usually a long hallway with some cones. For the children, what we've done is had them hold a Beanie Baby or a bracelet, like the bracelets that you received here, and carry them back and forth. So they have a task. So they're walking down that hallway, which is very boring. 6 minutes is a long period of time, and it's a standardized test where I'm not allowed to cheer for them. So I can only say certain things. It's very boring. So the bracelets are really the big deal with a 6-minute walk test. So, but that's a measure of endurance, and along with that, there's a test called the Borg, and the Borg is named after the person who developed it, but is a scale of rate of perceived exertion. And so in making it a little more palatable for children, there are some different little graphics out there where you can link it to smiley faces and things like that so that they can, it's very hard for a child to tell you whether it's very, very slight or very slight. There's not a whole lot of differences between those. So sometimes you have to be a little more crafty with the kids to get some of those measures. But the Borg rate of perceived exertion looks at fatigue pre and post, so you do it before the test, and it looks at fatigue and shortness of breath. So you get a measure for each of those pre-test and post-test. And that is probably the most commonly used. It's American Thoracic Society measure that has been used for a significant period of time. What I've learned, though, is the 6-minute walk test is not always palatable for everybody. And so there is a 2-minute walk test. There is, I have a cited reference at the end, but there is a research group that looked at the first 2 minutes of a 6-minute walk test, and it was considered a valid test in lieu of that first 2 minutes. And so sometimes I think the biggest part of being careful with patients is it's great if you have a 5-day protocol, which is how we started at our facility at Shriners. We had 5 days of which, of course, we could do testing. And then as things have changed with healthcare, it went down to 3 days. And then as they were no longer in clinical research trials, they're coming for 1 day. Okay, so I have to be really careful how many tests I'm giving one person in that day because they're exerting themselves and they get test fatigue. So sometimes a 2-minute walk test or a 30-second walk test are maybe more applicable. The 30-second walk test came up when we started having children who had been treated with Strensiq, and now we're getting these little bitty kiddos coming in, and we were looking for a test of their endurance. And so for 30 seconds, I can start at the very beginning of a very long hallway and put a toy or one of those little tight cars at the end, and I just walk with them for 30 seconds and time it. So some of those measures are really helpful to get an idea of baseline, and then what you want to do is kind of standardize if you're a hospital system or a physician using these tests or a therapist that are gathering these measures. And each time the patient comes back, you try to get the same test so you can eventually get a picture of how we're doing with things. And one final measure of gait and endurance that I think is important, I felt honored to be a part of this part of things, as we were trying to assist with functional measures, functional proof that, that aspartase alpha was helpful to patients. We could see it because they were no longer sitting, they were up walking and running and running up the stairs, as you saw earlier. But we were looking for a functional measure, and so along with a group of other therapists that have specialized in HPP, we developed the Modified Performance-Oriented Mobility Assessment of Gait. And it's a measure that allows you to score gait on a scale of 0 to 12 and look at whether the gait is, from a quality standpoint, is getting better. So not just did they walk faster, but the clip that I was going to use was the clip that Dr. Gottesman used this morning to show you the difference on the stairs. So if you think back to that, our little patient going up and down the stairs, not only was her time faster, but the quality of her movement. She did not have to use substitutions of holding her arms close to her body to get up the stairs. Now she could, alternate and reciprocally use her arms to get up those stairs faster. And then there are other measures of function. There's one called a timed up and go. That is a lot of times used in a more adult population, but we did start out using these in some of the pediatric patients, where you measure, you have someone sit in a chair and they stand up, walk 3 meters, and sit back down. I had to stop using that because the patients that were coming back that had been receiving treatment were almost knocking the chair down. And they could go so fast that it really was no longer a valid measure as they got better. But one that we did not start with, and I regret, was a timed up and down stairs. And that's a very important measure that you use. And we videotape it, and that's how we got the videotapes to show this morning. But the timed up and down stairs is just you have a person walk up a particular number of stairs and back down. It was standardized for 14 steps, and you time it. And so it gives you a measure to say how fast was it, but it still doesn't tell you, do they look better? So there's still some more information to add into their clinical record of, were they performing that in marked time, meaning they were stepping up with the same foot every time, or were they reciprocally walking up the stairs, which you saw that get better in the previous videos. Were they using their arms? And so there are other quality things. And so I think that leads me to the comment that videos are a really good way to capture some of the things that you can't capture with an outcome measure too. The videos are nice because you can always look back and see the difference, okay? I can try as a therapist to explain all of those little nuances in a note, but a picture is worth 1,000 words. So the videos are a good way to kind of capture some of that. Some of the functional testing and evaluation of adults, this is not my area of expertise, but Krishnani at the Softbones first scientific meeting had presented some of the functional testing of adults, and I think just recently presented that in the teleecho on Friday, of gross motor GMFM, gross motor function measure, and Gait Stairs Gower chair assessment. And the Gait Stairs Gower's chair assessment is just, again, a group of functional exercises where you walk for 10 meters, climb 4 steps on a stair. A Gower's maneuver is kind of how you get up from the floor, whether you have to use your hands on your knees or not. And that's graded 1 to 7. And so it gives you, again, a number that you can use and reference later. So measuring what matters most is whether you're functionally feeling and getting better, okay? And so this sometimes gets left off. It's very important to have patient and parent-reported outcome tools. So there are many that are listed here. They all have their little, acronym. The Child Health Assessment Questionnaire, the CHAQ, and these look at functional things like, over the last week, has your child's illness affected their ability to function in daily life? Are they able to wash and dry their hair? Are they able to reach to get a game or book from above their head or get a sweater over their head? So some of these measures are looking at those functional things, which are really what you're looking for to get better. You want those things to get better. The PODCI is a very commonly used pediatric outcomes data collection instrument, a lot of times used when you're having surgery, pre and post, or post-surgical measures that can be parent-reported or patient-reported. The Promise is something that our hospital organization and probably many others are now collecting. As you come in, you may be filling out some information on a tablet, and they're collecting some of those functional activities that you're able to do or not able to do for later comparison. The lower extremity functional scale, again, is more about how you're moving with lower extremities. And then for the younger children, again, as some of the kids were coming in that had been treated, and now I've got these 3-year-olds that are walking, I really needed some patient and parent reported tool. It's a parent reported tool at age 3 or 4, but this early activity scale for endurance was a nice one that parents could report how their child was doing. So clinical outcomes, they can help identify red flags in the HPP population and any other populations. But I think, again, I just want to drive in the point of baseline and continuum of care. It's important to get it at the start before you've done some treatments so that you can see if they're effective. So it helps you identify accomplishments and deficits. It helps you support the decision for treatment. So it doesn't always have to be about the negative, but sometimes what your findings are what help you support the need for treatment and for continuation of treatment. It helps you monitor the effectiveness. And so I'm going to show you some examples of that. It helps you identify red flags in this population with same-site injections. So that's one place where we could look at those measures again and see them drop. Lapse in treatment. We did have one particular patient who had a lapse in treatment, and you could see in the measures that things had changed. It was obvious that she went from a wheelchair to walking and then kind of back to a wheelchair again with a lapse in treatment. And sometimes the need to adjust for growth. So these are some of the objective measures and how they can be plotted and used by clinicians. And kind of tracked by yourself. You're probably not going to put yourself on a graph, but the blue line, where's my pointer here? The blue line right here is showing the 6-minute walk test in a patient pre-treatment, okay? And then as they were treated with aspartate alpha, you can see the really significant rise in function within 1 year. You can see it kind of bump up and keep going even higher. And then there is a little, plateau here. I'm not sure exactly why. Actually, that might have been during COVID, part of that time where people were all less active. The orange line is showing you the modified POMA-G that I explained, and that's a functional measure of quality of gait. And again, we started out rather low. We didn't start using that test until 2015, but then you can see how it went back up again and has a little dip. So sometimes the dip is not always explainable. But over on this slide, what you can see in the green, these are the norms for that child's age, and this is where they started. So they started very low in comparison to peers. This is a 6-minute walk test again, and you can see that after a period of treatment, they almost met, not quite met, but almost met that of peers. And so this is kind of how those clinical objective measures can help demonstrate function. This is an example of a decrease in treatment effect. And this was noted in the patient described earlier that was doing some same-site injections. So when I went back to look at some of the measures we had taken, because we take these standardly, the blue line again is the 6-minute walk test. So you can see the 6-minute walk test had a significant rise, and then all of a sudden, at one point, it just fell and dipped low. And that patient had come back. Over on the second slide, I did document what they were using at the time when they were being tested, and that particular individual started out in a wheelchair and then moved on to a walker with orthotics, and then at the very peak up here, they were using crutches with their orthotics, and then all of a sudden we just started this gradual decline. And you can see the same decline over on the left where we're looking at the 6-minute walk test. And the other measure here is a timed up and go. That's the one where you stand up from a chair and walk 3 meters and then sit. And everything had a significant decline. And then as that same site injection was identified, the times kind of go together, you can see it rise back up again. And that was also noted in the bone equality. So this is a particular patient that had some ankle instability, and they were scheduled for an orthopedic procedure, and the bone was too soft. So they did have to work on their injection methods and come back, and then it was a successful surgery after that. So now that you know more about you, and you kind of know how to figure out more about you with some of these measures, as a patient and a parent, you are the advocate. And a lot of people aren't going to know about this rare disease, and it's up to you sometimes to educate them. So when it comes to educate, you need to educate them about your diagnosis, your baseline. If you don't have a lot of hip range of motion and somebody's trying to stretch you past it, they need more information from you. Restrictions. You need to advocate, share what you know with your therapist, doctor, teacher, even if they don't always want to listen or the time is short that you have, keep at it. It's important to know about you. You may need to modify. So this goes back to those, if you're running and you've had a lot of metatarsal fractures, we either need to get some good shoes, improve bone quality, or maybe we need to modify activities. If you're that person sitting at the desk and your hip's bothering you, you may need to modify your seating. You can sit on a wedge that increases the angle that you're sitting at, and that will help. Address alignment, support. That could be the shoes or bracing or orthotics inside your shoes. You may need to address your environment, or you may need to use an assistive device, and there's nothing wrong with that. There are periods of time where weakness in gait, the weakness in hips can cause a gait which creates that side-to-side movement. That causes back pain. Sometimes using a crutch or a cane for a short period of time can alleviate some of that back pain because you're alleviating that side-to-side motion. So don't disregard that. it's hard to accept using one, but it may help you, and you can try it. And then prevent injury and fracture risk. Choose some areas of function that are important to you and set goals. Maybe your goal is pain reduction, improving activities of daily living that have been hard for you, your endurance, your recreational activities. Maybe we need to find different recreational activities, and exercise and health. So how can I deal with bone pain? So now I'm on to the questions. These are all the questions that have been submitted to me at times, and not everybody's the same, so there's no specific answer. I mean, the answer is specific. There's no general answer. This answer is specific to each of you. It depends on your specific bone health and limitations, okay? Reduce stress on bone and joints. So low impact activities are going to be better than high impact activities at times for you. Minimize stress to your spine, hips, and feet. Maintain good strength. Your strength of your muscles are supporting the bones that the muscles are all on top of the bones. They are supporting the bones. So having good strength is important in protecting the bone, and having low BMI, which again is difficult. And use an assisted device or orthotic. Sometimes, for short periods of time, people, you may need to use a wheelchair, or you may need to use a scooter, and there's nothing wrong with that. The fastest point from point A to point B, and you still have enough strength left to think and do what you need to do, is very important. Think about a college student on a college campus. They really need to be able to focus on their activities when they get there, not be so tired that they can't. So how can I conserve energy? Minimize unnecessary distances in stairs, organizing items close to where you use them, and use an assisted device. This is a picture we came up quite a while ago, because I think a picture is worth 1,000 words here. How can I prevent pain with prolonged sitting? If your chair is really, really low, the patient in the first picture, or actually it's my peer, but in the first picture, she's sitting with her hips flexed more than 90 degrees. So that's because her seat is low. And so if you're having pain in that situation, you might need to raise your seat height, okay? That opens up her hip angle, and now she's only flexed to 68 degrees. So if you went to the therapist and you've had a measure taken because you're somebody who's had hip pain and you're limited, maybe 96 degrees, your hip doesn't go that far, okay? And so what most people figure out after a while is they'll just let their legs slide off the front of the chair, okay? And that's what we all do in an airplane. If you have a painful hip, you try to sit on the aisle where you can stretch your leg out just a little bit and not force that hip. How can I prevent pain when exercising? Okay, sometimes the bicycle seat's too low, and everybody forgets that that's really important too, because as you're coming up and you're bringing your leg around, if your bicycle seat's too low and you don't have that much hip range of motion, you're gonna cause pain. So sitting with the seat higher is better. What are safe exercises? If you're really having issues with the exercises that you're performing, consider swimming. You're buoyant in the water. You get resistance over the entire surface of your limb when you're working in the water. So if you stand in waist-high water and you walk sideways, the pressure is all along the entire side of your leg as you bring your leg apart. Okay, the faster you walk in the water, the more resistance. As opposed to going to the gym where you're going to put a weight down at the distal end of your extremity, you're creating a stress riser there that can cause problems. And so it could cause a fracture if you don't have the right bone quality. So a lot of times I have people ask me about, can I be lifting weights at the gym? But I think that really needs to go back to your doctor and what your bone quality is. Cycling over running is maybe a low impact activity if your seat's set high enough and you're comfortable doing that, you don't have a bum knee. Yoga, Pilates, or Tai Chi are some of the questions I've gotten too. And I feel like yoga kind of helps you recognize and pay attention to your bodies. But you have to be careful about some of the poses that are requiring too much flexibility. More of the standing ones are probably better if you have some hip pain. And Tai Chi is very nice, and not that I've done it, I don't know if anybody has, but all those slow movements, the slower you move, the more you're using your core, the more you're using your muscles. It's actually, you can when you move faster, you don't require as much strength if you move faster. You require more strength if you move slowly, because you're having to use your muscles. How can I be proactive? Listen to your body, strengthen muscles, honor your bony limitations, address pain. Sometimes pain can be addressed with something as simple as a massage mouse, which is a TENS unit, transcutaneous electrical nerve stimulators, a type of stim to help decrease acute and chronic pain, and it works by interrupting the pain signals that travel from your tissues to your brain. And so that may be an option. Support instability, eat healthy, and take advantage of established resources, and that includes soft bones. There are a lot of resources on their website. Your physicians are resources. Shoes and orthotics, what type of shoes should I wear? Probably something a little bit more supportive. You know, I personally think Tevas are a nice hiking sandal as opposed to a flip-flop. That's not going to give you a whole lot of medial arch support. New Balance, some of those companies that tend to measure you for a specific shoe based on your foot pattern, Fleet Feet. It doesn't always need, you don't always need an arch support. That may not be the position of your foot, so again, it's specific to each person. Will inserts correct knock knees or bowing? And the answer is no. It does help prevent things from getting worse, but it doesn't change a deformity that's at your knee. So with HPP, sometimes some of the children have a knock knee a prevalence, and putting something inside their shoes is not going to make that better, but it's certainly not going to make it worse. So inserts are helpful if you have a flexible flat foot. And then involve your specialty physician and multidisciplinary team. So it's important to be inquisitive, okay? If you're not getting enough information, inquire about your specific bone health and limitations. Explain why you want to know. I want to know because I want to work out, I want to lift weights, or I want to go jogging. If that's important to you, you need to know a little bit more. Inquire about resistive exercise. That also depends, like I explained, on your bone density and fragility. Request documentation. So sometimes this is the part that gets forgotten. Your physicians and your therapists can help by writing notes. If you need a note to school for PE restrictions or modifications, notes to your employer for work-related restrictions. Maybe you need just some ergonomic changes in the way that you're sitting at your desk, and sometimes your workplace can help you with that. Or if you have a particular workout that's not working well for you and maybe it just needs a little bit of modification. So in conclusion, I hope today that I was able to kind of explain some of the reasons why clinical objective measures at baseline and follow-up will help you know a little bit more about yourself to guide decisions about your care. Listen and get to know your body specifically, because HPP is all over the place with severity, mild and severe. Let that guide your activities. Focus on the positives and set specific goals that are important to you, and utilize all your available resources. And then this is my contact information. I am available on the HPP, is it the TeleEcho? There is that consortium. Yeah, Connect, HPP Connect. And so, and then that's my email, but I'm at Shriners Hospital and continue to work there with Dr. Gottesman and Dr. White for as long as we will, right? All right, thank you so much.